Hi, my name is Sarah Faust. I'm one of the social workers at Prairie Lakes Hospital. I give community presentations about Advance Directives, and with all of the concerns regarding COVID-19, people have had some questions about what they need for Advance Directives, as well as the treatment options they would want for themselves or family members that they are making decisions for. The fear and uncertainty we are all feeling related to COVID-19 is real, and it is understandable. During so much uncertainty, one thing you can control is who would speak for you if you cannot speak for yourself, and what decisions you would want to have made. Having your advance directives in order and talking to your loved ones about them is so important, and the best time to plan for future healthcare decisions is before a medical crisis occurs. I hope this presentation will be helpful in planning for future healthcare decisions that we all may face. This presentation is not intended to provide healthcare advice, but is to provide information so you can talk to your loved ones about what healthcare decisions you would want if you are not able to make decisions for yourself. Today, I'm going to provide you some information about advance directives, what they are, who needs them, and how to complete them. I will also discuss some of the issues specifically connected to COVID-19. If there is one thing that I want everyone to take away from this presentation, it's that the most important thing you can do, both during this time of pandemic, but also for all healthcare decisions, is to have conversations with your family and loved ones, as well as your healthcare team, so that they know what your wishes are. Those conversations are truly the best thing you can do to make sure you receive the level of care that you want. So first, let's start by talking about what an advance directive is. An advance directive is something that is set up before you need it. It is effective while you're still living, but may not be able to speak for yourself. Today we're going to be talking about medical advance directives, but you can see there are a wide variety of instructions or advance directives that are important to talk to your family about. So advanced care planning is something all adults should do. I think too often we think that this is just for the elderly or the ill, and the reality is that it's something all adults could have in place because we never know when an event might happen that would require somebody to make medical decisions for us. It really involves thinking and talking about your future healthcare decisions, what you would want done in the event that you cannot make your own decisions, and also deciding who you would want to make those decisions for you. A lot of people have reservations about completing their advance directives, and there's a variety of reasons for that. Sometimes it's that belief that it's only for the ill or the elderly, like I mentioned. Also, people don't know where to find the forms, and so we're going to talk today about where you can get the forms for medical advance directives. Sometimes the reality is that these are just really hard conversations to have, and it's difficult to start talking about them. That's one of the things I'm noticing with the COVID-19 concerns is that people are having conversations, and so we wanted to give some direction to help you, patients and families, to be able to have those conversations and to give you some direction for that. Sometimes people don't know who they would want to appoint for their healthcare power of attorney, so I'll give some guidance and direction on that. There's also the concern that it's too expensive and I don't have the funds to do it. For medical power of attorney or medical advance directives, there actually is no cost. Patients are able to complete them on their own, and then they just need to be notarized, or in the case of a living will, witnessed by two people. So there's no expense for it, and we want to help assist you in being able to do that if it is something that you're interested in doing. So why should you have an advance directive? I think that's a valid question. One of the reasons you want to have an advance directive is to make sure that you receive all the treatment you want, or maybe that don't receive the treatment that you don't want. It gives some guidance and direction. One of the biggest benefits of having an advance directive is to take care of your family. I can't tell you the number of families I've sat with that have had a difficult time making decisions on what they're going to do because they never had the conversation about what their loved one would want, or they feel guilty for making decisions that they can see they need to make but aren't exactly sure what they're the right decision. There's also been the numerous families that I've sat with that feel such a sense of peace knowing that they are making the absolute decision that their loved one would want, that they had these conversations and they had some clear direction, and just the peace and comfort that they have during that difficult time is tremendous. Having an advance directive also gives your physician the direction that you want to go. It lets them know exactly where you're at with your treatment and what your wishes are. And finally, having an advance directive makes sure that you have somebody advocating for you, being your voice and talking for your needs. There are 3 things all adults should consider with advance directives. First is who would make medical decisions for you if you are unable to speak for yourself. Second, looking at if there are any values or beliefs, personal, cultural, religious, or spiritual, that guide you and may affect your treatment decisions. And third, talking about what your goals of treatment would be if you permanently lost the ability to know who you were or to know who you were with. So let's look at those in more detail. One of the most important decisions we encourage all adults to make is choosing someone now who would be able to make future decisions for you if you are ill or injured and unable to make decisions for yourself or to communicate your wishes. This person would only make decisions if you had a sudden event and could not make your own decisions. You will also want to choose an alternate or 2 in case your first choice is not available. We always recommend identifying one primary decision maker who can be the spokesperson for your family to talk to healthcare professionals with. So let's say you have someone in mind. First, you need to ask them if they are willing to be that person. There may be family or partners that might seem like a natural choice, but it's important to talk with them about that role. Some people actually choose not to have family as their agents, or I hear families say that I should choose my oldest or I'm closest to this child. You're not necessarily looking for the person that you're closest to or the oldest or things like that. You want to make sure it's the person that's going to be able to make the best decision in a difficult moment. You need to ask them if they're willing to talk to you about your goals, values, and preferences, and whoever you choose, communicate with them so that they know what your current wishes are and any changes to your wishes as your life changes or as circumstances change in your life. Ask them if they will agree to honor your wishes, even if those wishes are different from your own, because they are speaking for you, not for themselves. And then your agent should be someone who is able to make decisions during very difficult or emotional situations. So again, they need to be able to make difficult decisions in difficult moments. Keep in mind that the more you share with your agent and other family members, the less stress, confusion, and potential conflict your loved ones are likely to face. Make sure you tell other family members who your agent is so that there are no surprises and so that they can be supportive to your agent. Your agent or healthcare power of attorney may be wondering what they should do. It's really important that they first know what you've written down, what your living will or power of attorney states. Then they should look at your religious beliefs and values and just who you are as a person. I've had families say, he was larger than life, and if he can't continue to be that, I know he wouldn't want to go on. And so they need to really be able to evaluate who you were and how you lived and what you would want for your life. They should also look at how you've handled other healthcare decisions and what choices you've made for how much medical intervention you want. They also need to look at the benefit of or versus burden as far as how much you're going to improve versus the amount of burden, both financial and physical, that treatment would place on you. They really, again, need to be the voice for your wishes and your advocate. The next thing you're going to want to do is explore your cultural, religious, spiritual, or personal beliefs. Some questions you may ask are there any cultural, religious, spiritual, or personal beliefs that might help you choose the care that you want, or maybe that you don't want? Are there practices that are important to you or give you comfort, such as praying, singing, or eating certain foods? Is there any special music? We've had everything from Elvis to hard rock to hymns and ballads. So make sure your family knows what your wishes are for you to have towards end of life. This may also include religious traditions, such as if you're Catholic, you want to be sure you have the anointing of the sick. So make sure that those are expressed and those wishes are talked about with your family and loved ones, and especially the person making healthcare decisions for you. And then finally, evaluate if there's somebody that you need to talk to about these beliefs or concerns. Do you have concerns about what it means to not have any nutrition or hydration towards end of life? Questions like that may be something you need to talk to a healthcare provider or a spiritual person, a religious leader. And so make sure you have those conversations and you feel at peace with those issues. One way that is very helpful in evaluating what is important to you is looking at how you would live if you were having a good day. What would happen on that day? Who would you talk to? What would you do? Now, this is going to look very different for people at different stages in life. Somebody in their 20s might consider it a good day if they can be out and active and doing things with friends or family, playing sports, involved in different activities. For them, that might be required to have a good day. Whereas somebody in 85 or 90 might consider it a good day if they can get up and take care of their own needs, watch TV, read the newspaper. So evaluate what is good for you and what would be a quality day for you. That will help you be able to have conversations with your loved ones about how much you're willing to sacrifice for treatment if you're not able to return to that style of a good day that you've discussed. The third thing to consider are your goals for medical care if you experienced a sudden illness or an accident that causes a severe and permanent brain injury, one in which it is unlikely you will recover the ability to know who you are and who you are with. If you were in that type of situation where the doctors had confirmed that there was little chance that you would recover or survive or would not regain your previous level of functioning, possibly having to live with machines, would you want to continue that medical treatment to keep you alive, or would you want to stop medical treatment that is keeping you alive? No matter what, you're going to be kept comfortable. That's always the standard in healthcare, that you will be kept comfortable. But given that situation, take some time to think about that and have that conversation with your family. Doctors have described that you will not be recovering. How would you prefer your care to be focused? Would you want it to keep you comfortable without extreme medical intervention, or would you rather have medical intervention that would keep you alive longer? Now, I wanted to take some time to discuss the COVID-19 specific decisions as we're talking about what you would want for your healthcare decisions. I have some resources that I have some information from I'd like to share with you. These resources come from Respecting Choices and NHCPO, which is the National Hospice and Palliative Care Organization. The resources are priorities for medical care and treatment options, and then discussing complicating factors for people who have multiple health issues currently. We'll talk a little bit more about CPR as well as specific help with breathing. And then we have a shared decision-making tool we'll go over that can help people decide what treatment they want if they were to get COVID-19. The first thing we want to look at is, what are your priorities? There's really three major options. The first one is living longer, which would involve full treatment. Second is maintaining your current health, so that you would pick and choose which treatments you would want and not going to the full extent of being kept alive by machines. And the third option is comfort, focusing solely on all of the comfort measures that are available, knowing that this is going to lead to end of life. So a little bit more detail about each of these. The first option of living longer means that your value is really that you want to live as long as possible, even if you don't know who you are or who you are with. It involves being in the hospital and receiving all of the care that your doctors think would help you, even if it means relying on machines. So this treatment may involve sustaining your life by all medically effective means, including any of the medications and treatment that would keep you comfortable, of course, and emotional and spiritual care, which are a routine part of medical practice. It also would involve potentially being in the intensive care unit. It would give you a full treatment of all options available that are effective, including the ventilator, IV medications, IV fluids, and it could potentially involve long-term tube feedings if you're no longer able to eat on your own. This option does include CPR, intubation, and possibly being on the ventilator. The next option of maintaining your current health would be a good option if your value is really to live longer, as long as the quality of your life and comfort can be achieved. It would involve being in the hospital if needed for effective care, but it would also stop treatment that is not working or that's making you feel worse. It would allow a natural death if your heart stops or your breathing stops. The treatment options for maintaining your current health might include things such as, again, medication and treatment to keep you comfortable, and then emotional and spiritual care. It would maintain your health while avoiding burdensome treatments. So you would likely be in the hospital, but would not be in ICU. It would involve non-invasive positive airway pressure, such as a BiPAP, and I'll talk more about that in a few minutes. It would give you a trial of selective treatment if you want, or if your family decides for you that you would want it, involving that non-positive airway pressure. And it would also include IV medications and fluids, and potentially short-term tube feedings until you're able to recover. With this option, it would not include CPR, intubation, or a ventilator. The third option then is comfort. And if your value is really living the rest of your life focusing on your comfort and quality, but not wanting to be in the hospital or being on machines, and recognizing that this would allow a natural death if your heart or beating stops, then this would be the best option for you. It focuses on comfort treatment, maximizing your comfort through symptom management. Again, like the other options, includes medication and treatment to keep you comfortable and the emotional and spiritual care you need. It would only involve being in the hospital if your comfort needs were not able to be met at home. It would include oxygen and treatment for airway comfort, and also medications needed for your comfort. There would be no IV fluids or tube feedings. It would just be what you are able to take by mouth. And again, this option does not include CPR, intubation, or tube feedings. Now I want to take a few minutes just to talk about CPR, or cardiopulmonary resuscitation. This is especially important for people who may have complicating health issues, like a heart or a lung disease or cancer, and you're facing other decisions about attempting CPR. We often have patients question what CPR really is and the effect that it might have. So first, when you're looking at CPR, there's really the option of attempting CPR or not attempting CPR. If you have CPR, it is done for you by somebody else, and it can include different options of pressing on your chest to make your heart beat. It could be a tube to help you breathe, or the electrical shock or drugs to help your heart beat. It attempts to restart your heart and your breathing, and if you receive CPR, you will need to be on a breathing machine for a period of time, and you'll also need to be in the intensive care unit for your recovery. You may have damaged or broken ribs as a result of the CPR. Long-term burdens could potentially be having a mild or severe brain damage as a result of the lack of oxygen or your body not functioning correctly, and it may mean that you are no longer able to live alone or independently. This is a good option if you want a chance to live. As long as you're willing to accept the fact that CPR may not restart your heart and breathing, and that you're willing to accept the burdens of CPR. Again, for a majority of the population, this would be an option that they would want. But for patients that have complicating health factors such as heart or lung disease or cancer, this is something that they would want to consider if that's something they would like to pursue. The option of not attempting CPR then means that you will receive comfort measures, and you will be kept comfortable, but that it will allow you a natural death. It means avoiding all machines and the other burdens and consequences of CPR. If you prefer a natural death and are unwilling to accept the fact that CPR may not restart your heart and your breathing, then CPR would not be the best option for you. Some of the statistics for CPR, I think it's important that people have a realistic understanding of what the likely outcome of CPR is. And so these statistics are for adults that already have a serious illness and if they get CPR and live. So if they're in the hospital and they already have a serious illness, about 15 out of 100 people that have a CPR attempted leave the hospital, and they live an average of 4 months. And again, that living may not be the quality of life that they want, but they do stay alive for an average of 4 months. If you look at patients outside of the hospital that receive CPR, who again have other co-occurring conditions, about 5 out of 100 people leave the hospital and may live up to a year. Adults living in a residential setting who get CPR, about 2 out of 100 leave the hospital and may live up to 1 year. So again, these are all factors that you want to consider when you're receiving CPR. CPR is definitely something that we use to keep people alive and to extend life, and it's very valuable when it works. Just be realistic that CPR doesn't always work, and it may have some serious consequences. Next, I wanted to talk about some options that you have regarding breathing decisions. There's really 2 major options, and again, of course, there's always the comfort-focused treatment, which means that you're not going to have any serious medical intervention. You're just going to focus on symptom management and would be avoiding machines. So if you're looking at needing assistance with breathing, the 2 major options would be a ventilator or a non-invasive airway like a BiPAP. Both of these machines push oxygen into your lungs and help you breathe, and they both may allow you to recover from a breathing problem, and they may allow you to live longer. A ventilator specifically is a tube that goes into your mouth or your nose, down your throat, and into your windpipe. The tube is connected to a machine, and it's called a ventilator. With the tube, you're not able to speak or swallow, and you need medicine to help you stay calm, and you would need to be in the intensive care unit for this. It is a stronger option for breathing assistance. The risk is that you may not be able to get off a ventilator, and if you remain on it, you may need long-term ventilator care. Your health may get worse, and other problems may occur as a result of it. This would be a good option if your value is really to have the chance to extend the length of your life and you're willing to have some discomfort and be in the intensive care unit. Also, if you are willing to take the chance that you would need long-term ventilator care, this would be a good option for you. The option of a non-invasive airway, such as a BiPAP, this is a tight-fitting mask that covers your nose and mouth, and the mask is connected to a machine, again, that pushes air into your lungs. The mask may cause some skin irritation, and it makes it hard to talk or eat. You may need medicine to help you stay calm with it, and it was likely that you would need to be in the hospital, but not necessarily the ICU. This potentially may not work, and your breathing problems may continue to get worse. But it is a good option if your value is that you want a chance to extend your life and you are willing to have some discomfort and be in the hospital, but you do not want to take the risks of being on a ventilator. So again, the primary options you would have with breathing assistance would be being on a ventilator, which is a machine with a tube that goes down your throat, would involve being in the ICU, or non-invasive airways such as a BiPAP, which is a mask that covers your mouth and pushes air into your lungs, with the final option being that comfort-focused treatment. Now, given everything that we've covered so far, the last tool I wanted to go over is the shared decision-making tool, which was developed by the National Hospice and Palliative Care Organization specifically for COVID-19 to help people make decisions about what treatment they would want. Some of these decisions are really difficult and hard to talk about, but I think these are the questions that I've had people ask me: what level of treatment they would want and how far they should go for treatment. So this tool is a nice opportunity to have that discussion. It has 3 questions in it, and the first question that it asked is, what is my or my loved one's likelihood of surviving COVID-19? It breaks down some of the risk factors that they have found with COVID-19. The first risk factor being age. What they found is that people over the age of 80 have a poor survival rate. That at the time that this was developed, the death rate for people over 80 years old was 21.9%. In the 70 to 79%, it's still a higher death rate, but a little bit lower. And then the 60 to 69-year-old has had a 3.6% death rate at the time this tool was developed. So you can see that the older you are, the higher the risk of not surviving, and may make a factor in how much treatment you want. The other factor to consider is your pre-existing conditions. The conditions that they identify are heart disease, diabetes, chronic lung disease, high blood pressure, and cancer. And then if there's no pre-existing condition, the death rate is, at the time this was developed, was 0.9%. If you have multiple pre-existing conditions such as heart disease, diabetes, lung disease, high blood pressure, or cancer, your survival rate lowers. And so again, if you have a combination of a pre-existing condition as well as age, you may want to consider those factors in how much treatment you would like to receive and what level you would be at. Again, this is all just to help you have conversations and to make decisions with your family. The next thing that they looked at in this decision-making tool is, what are the symptoms that you're having? Symptoms generally progress from mild to difficulty breathing, with an average of 5 days, moving to the acute respiratory distress syndrome within about 8 days. And so if you're having light symptoms such as fever, cough, or shortness of breath, that may be very treatable. If symptoms get more serious, such as difficulty breathing or shortness of breath, persistent pain or pressure in your chest, confusion or an inability to arouse, or bluish lips and face, that is much more serious symptoms. You definitely need to consult your doctor or emergency medical personnel and again, evaluate how much treatment you would want with that. The third question they look at in the shared decision-making tool is, what is the likelihood to survive? And again, this is very hard, but I think these are the conversations and the questions people are asking. Most COVID-19 hospitalizations are a result of the problems breathing. So again, at the time of this was developed a few weeks ago, about 32% of the individuals with it ended up in intensive care, and around 15% of those died. Those are stark, hard numbers, but again, can help make decisions as far as how much treatment you would want. And just to be aware, even in the absence of COVID-19, in general, people older than 66 years old who stay in the ICU for over 14 days on a vent, only 19% of them were discharged home directly from the hospital. So even without the complication of COVID, the reality is that it would likely involve an extensive rehab time and some recovery time with that. So with all of that involved, some of the things to help make your decisions are based on those risk levels and those questions, including what risk factors do you have regarding age and pre-existing conditions, what are your current symptoms, and what is your likelihood to survive, you can look at what the risk level, what you would want for your treatment. Maybe you choose home with symptom management, or that second option of maintaining current health and providing the selective treatment, or going to the hospital for full life-saving measures. All of those are your right to choose what options you want. We just want you to be able to make educated decisions so that you know what you're getting into going forward. Now that we've gone over what options you have for treatment and selecting your power of attorney, I wanted to take some time to go over the actual forms themselves. There's some different options for forms here in South Dakota. The first one is a durable power of attorney for health care, as well as the living will. Now, in South Dakota, that living will form is often included in the power of attorney form. So if you know who you want to appoint for your power of attorney, that document generally includes the living will. These forms can be found on the Prairie Lakes website. So if you go to www.prairielakes.com and then select the Patient Information tab, then it will give you the option of looking at Advance Directives. And in that Advance Directives section, there's a thing you can click on that says Healthcare Planning. If you go to page 11 in that Healthcare Planning book, that is the Durable Power of Attorney for Healthcare documents. And again, if you know who you want to have for your power of attorney, you do not need to do the separate living will form. Now, if you don't know who you would want to select for your power of attorney, it's a very good idea to complete that living will document. And so we'll talk about that a little bit more in a few minutes. The other options that you have then would be medical orders. And medical orders are a little bit different than the legal documents of a power of attorney. They need to be done with your doctor and would be a conversation for you to have with your doctor. In South Dakota, the two options we have are the MOST form or the Comfort one. So the Durable Power of Attorney for Healthcare document is the one that appoints the healthcare agent that will speak for you in the event that you are unable to. That document also includes what care you would like to receive if you are not able to direct your care, which is the living will component of it. If you do not have a legal durable power of attorney document done in the state of South Dakota, the order that family will be consulted in begins with a spouse and then an adult child, then a parent, an adult sibling, grandparent, an adult grandchild, and then it will go to an aunt, uncle, cousin, niece, nephew, and then a close friend if none of those are available. So that's the chain of order that is followed in the South Dakota state statute if you do not have a power of attorney completed. A couple things to note with your healthcare agent. These are just frequent questions that we get. It may or may not be a family member. Like I mentioned earlier, you may not want it to be the person that you are closest to, and you may find that the best person to make healthcare decisions for you is a close friend. I think most people have their spouses, but some people prefer not to have their spouses in order to protect them, or just concerns that it would be too difficult for them to make decisions for that. So it doesn't necessarily need to be the child that you're closest to or the oldest child. It just needs to be the person that would be able to make the best decision for you. Please note that they are not responsible for the cost of care. So healthcare decisions that they make does not mean that they will be responsible for any cost that's incurred. Some other things they're referred to as an attorney in fact, a proxy, a representative. There's lots of different names. They all just represent that healthcare agent or durable power of attorney. Some things that they would be expected to do is basically to act as you would act in your place, keeping in mind that this is only in the event that you are no longer able to speak for yourself. This is not a release of information or a freedom for them to have any information. This only goes into effect in the event you're not able to speak for yourself, and basically gives them all authority that you would have to make medical decisions for you, including donating organs and applying for medical assistance as needed. The living will then is the document which determines what treatment you would want in the event you cannot make that decision for yourself. Like I mentioned earlier, this information is included with the durable power of attorney for healthcare. In our document then, on the first page, you would appoint the first person that you would choose as a power of attorney. And then in the second page, it discusses what options you want. And so it gives you some different options. The one being if you already have a living will, to follow that. The second option being to give grant discretion to the person who is your power of attorney for healthcare. And then it gives the third option then is if there is no life-extending treatment that you wish, then that would be your option. On the next page, it talks about if you would want full treatment, that's the option you would select. Or if you want to do something else in your own words, you can write that there. You need to initial which option you would want for that. And again, this information is separate in the living will document, or it's in the durable power of attorney for healthcare. It really just identifies what you would want done in the event that you're not able to make decisions for yourself. It also includes questions about artificial fluids and nutrition, what you would want in the event that there's likely no chance of recovery. Would you want to continue to have fluids and nutrition, or would you not want to do that? Do you want aggressive care versus comfort care? On the document, you need to initial which options you would want. So the South Dakota Most and Comfort One are those medical orders I mentioned earlier. These are medical orders and not legal documents. There would be something that would need to be signed by your doctor. And they would only be available for patients that are terminally ill or have a likelihood of a short life expectancy. This is a conversation for you to have with your medical provider, and these documents would be signed by both of you. With both of these documents, they focus on providing comfort but limit life-extending interventions. So they would keep you comfortable but would not include things such as CPR or machines that would keep you alive. Now these two options, Comfort One has been around for a fairly long time. It's basically a out-of-hospital DNR, or do not resuscitate. This would be a good option for you if you are somebody that is out in the community, but maybe you have a life-limiting illness such as cancer, you're on hospice, or you have a disease that you know you won't recover from, but you're still able to live a fairly healthy, active life. What it does is, again, you talk with your doctor. If your doctor is in agreement, you would both sign the form. You send the form into the South Dakota Rural Health with a small fee. It's about a $35 fee. And then they send you a bracelet that you're able to wear in the community. So if you're out and about and something happens and an ambulance is called, the ambulance would be aware that you are a DNR status. They will keep you comfortable. They will take all measures to keep you comfortable, but they're not going to start the life-extending measures that typically happen when an ambulance would be called. The South Dakota Most is a newer option that South Dakota just joined the rest of the country in having this option. It's a medical order for the scope of treatment. Again, it's for people that have a terminal illness or life-limiting illness. The goal of this option then is to inform and empower you as a patient to clearly state what your end-of-life care wishes are. It authorizes healthcare providers to really carry out those wishes. Now, this is a document, again, you're going to talk to your doctor about if this is something that you're interested in. They will go over all of the different categories, including CPR, what types of medical interventions you would want. If there's any artificially administered nutrition and hydration wishes, they're going to go over each of those specifically. And then you and your doctor will both sign this document saying that you're in agreement. And so you would basically then be a do not resuscitate, do not intubate type of options. So again, that's a fairly new option of South Dakota that South Dakota has gotten in the last year. It's been a nationwide program for several years. So the nice thing about that option is it's recognized across state lines as a standard of care and treatment for you. So now that you've had time to think about everything, you've taken time and gone through the documents and you've started to fill them out, what are the next steps? Again, the biggest thing you can do is communicate your plan with the people that are important to you. This includes your healthcare agent. It may include other family or friends that would be important in your lives, as well as especially your healthcare agents, your doctor or primary caregiver, nurse practitioner, whoever it is that you go to for your healthcare. You want to communicate these wishes with them. Make sure you get copies to the hospital and other places where you see medical professionals, and just really have those conversations with the people that are important to you. Keep a copy where it can be found. This can be in a variety of places, in a safe. This may sound funny, but I've had people leave it in their freezer, in their fridge, because it's fireproof and they know where to find it. Some people put it up next to their door. Just make sure that it's somewhere that's accessible and can be easily found. And again, take it to the hospital. If you end up going to the nursing home, make sure they have it on your medical record there. Some things to consider when completing your advance directives are, do you have a local physician? Who is the doctor that you would go to in the event that you need something? Do you go somewhere else part of the year, and do you need to complete another advance directive in that state as their state laws require, or can you take the document that you completed here? The other thing to look at always is your document current. You should update it regularly, and so maybe you've done it a while ago. Take it out and review it and update it if you need to. We often ask if family members can override your request. I'd like to say that they can't. They're not supposed to be able to, but the reality is that in the moment when doctors are asking questions, families may make decisions. And so again, it's all the more reason you want to have this conversation so your families can know without questioning what your wishes are, because the reality is in the moment a power of attorney may be able to make a different decision, and it may cause some confusion or conflict in that moment. So make sure everybody knows what your wishes are. So when is it a good time to either start or to revisit your wishes? I can't say this enough. This advanced care planning is a process. It is not a one-time event. It is something that you should always evaluate and look at again. Things change as your circumstances change, and so you should really review your wishes every time you have a physical exam, and this is essential before there's a medical crisis. One of the good things that Medicare has started doing is it has started encouraging doctors to have these discussions. So I've been seeing that doctors have these discussions much more often than they used to. And that's a good thing, to talk with your doctor about what your wishes are and what you would want to have done in the event that you have a medical crisis. So kind of a good guideline of how often to review your 5 wishes is those 5 Ds. Every decade on those big birthdays, review it. If there's a death of a loved one, especially if that loved one is one of the people that are on your power of attorney, you need to review that document. Or if you have a divorce, a major diagnosis, or if your health just starts changing, you have a decline. It's good to take time to review that document and make sure it is what you want. Also, keep in mind that there's no reward for speed. You want to keep it simple, pretty straightforward. You don't have to make it complicated. You just need to express your wishes and make sure your family and loved ones know what your resources are, or know what your wishes are. We at Prairie Lakes Hospital are a resource for you. If you have any questions or concerns about this, please contact Prairie Lakes Hospital at 882-7000 and ask to talk to a social worker about advance directives. Again, my name is Sarah Faust. I'm one of the social workers here at the hospital, but all of the social workers are trained to help you with your advance directives. You can also talk to your doctor or other people in the community. One of the challenges we're currently facing with completing advance directives is they do need to be notarized. I didn't talk much about that, but the durable power of attorney for healthcare, it does require it to be notarized in order for it to be legal. And so if you do the document, do not sign it until you're in front of a notary, because if you sign it, you'll have to redo it. They need to witness your signature. So if you can access a notary, that's great. The banks do have notaries, and I've been told that if you call the bank and ask them for a notary, that they might be able to allow you in to assist you with that. Again, The biggest thing is having these conversations, having the discussions. So if you go through the document, complete it to the best extent that you're able to, and then have the conversations with your family so that they know the decisions that you would make. If you don't have it in writing as a legal document, again, it goes through that legal order of a spouse, an adult child, a parent, a sibling, and then down that line that I reviewed with you earlier of who would be the one to make those decisions. So the most important thing is that they know what decisions you would want to have made. If you're just completing a living will because you don't know who you would appoint as your durable power of attorney for healthcare, that document needs to be witnessed by two separate people. It's a little bit confusing, but I was informed by a lawyer that the reason for that is that it has the word will in the title, and in order to have a legal will in South Dakota, it has to be witnessed by two individuals. So if you're just completing the living will, you would need to have that witnessed by two people for you. So thank you for your time. Again, if you have any questions, call Prairie Lakes Hospital at 882-7000 and ask for a social worker to assist you with your advance directives. We're happy to help you with that at any time. Thank you for your time.